Hi, everyone. I'm Zain Ali. I am a third-year medical student at Texas Tech University in Lubbock, Texas, and I'll be presenting on a challenging case in which we used ECOS in a 78-year-old male presenting with limb ischemia. I have nothing to disclose. This was a 70-year-old male with peripheral artery disease, coronary artery disease, status post-MI, hypertension, COPD, obstructive sleep apnea, and a history of Guillain-Barré syndrome. And he said that he was an ex-smoker, and we tried to believe him. But with this case, it was kind of difficult to see that. The patient presented to the ER with weeping wounds in both of his extremities and with cold feet. He described no pain, and there was very limited, but his motor function was weak. Upon physical exam, there was non-healing wounds and worsening blisters, and the right foot was dusky and cold with very poor peripheral refill. There was no posterior tibial artery or dorsalis pedis pulse, and the vitals were fairly stable with him having tachycardia. We decided to do a Doppler scan to see what was going on, and on the right lower extremity, we noticed that there was full occlusion of the SFA and the popliteal artery, and there was critically reduced flow in the distal PTA. And then the anterior tibial artery, as well as the peroneal, were also occluded. In the left extremity, there was stenosis in the popliteal, and then stenosis in the SFA, and then atherosclerosis as well in the entire extremity. As you can see in this image, the first two show that there's absolutely no flow in the proximal SFA or the popliteal artery, and then very minimal flow beyond that. And then we decided to take him to the cath lab and do angiography. And then in this image, you can see that the first image, there's no flow through the profunda or in the proximal SFA. And the angio continues to show that there's no flow in the popliteal. And going down, there's collateral flow through the PT. And then we decided to do a selective microcath, and then we saw that that's where the collateral flow was. Like after there was a previously placed stent, and then we noticed that after that there was flow. We decided to do percutaneous transluminal sequential balloon angioplasty, and in which we increased the size of the balloon, and we saw no improvement in the flow from that. And then we decided to continue with the penumbra catheter in both in antegrade and retrograde fashion. And then we ballooned that as well, and upon aspiration we didn't notice much improvement, and there was still a very high clot burden. And these images can show you that the angio of the plantar foot, and then continuing on, there was still very little improvement in the last image. And then we continued on, and then we have a Texas Tech acute limb ECOS protocol, and in that protocol we use the ECOS catheter, and then we placed that in the proximal PTA, and we did an overnight infusion of alteplase. And then the following morning we removed that and then did a balloon angioplasty. And then, as you can see, there's a lot of improved flow in the entirety of the leg, going from the proximal SFA to the distal SFA. And then we noticed a small segment in which there was hindrance of flow, and then we did a scoring balloon of that area of the SFA. And then we continued on, and as you can see, there's no collateral flow. It's rather direct flow of both the PT and the AT. And then there's continued flow into the plantar arteries as well. We did a follow-up Doppler scan, and we noticed there was significant improvement in both the SFA and the popliteal. And then we noticed that the previously placed stent was patent. And these images are from the Doppler, and as you can see, there's biphasic flow from the mid-stent all the way through the stent, and then all the way down the leg as well. So the key takeaways is that ECOS is usually used in various different, there's PE, there's other applications for it, but we use it in the acute limb ischemia because we were able to prevent limb amputation for the patient, and then other devices that we had used weren't being helpful for it. And in acute limb ischemia, these are long cases that take a lot of time. They are using a lot of contrast and a lot of radiation for the patient, and with our protocol, we saw benefits in that the patient had better outcomes, decreased time for recovery, and then decreased contrast and radiation for the patient.
Thank you. Perfect. So let me start by asking you, so with somebody that comes in with what seems to be more like critical limb ischemia, wounds non-healing and seeping and stuff, What made you think of like there's going to be thrombus there? Why did you treat it as an acute limb ischemia?
So he had cold feet, so we thought that there would be some sort of clot, and so we
So
decided to do
you thought it was like acute on chronic?
Yeah,
Okay,
exactly.
okay.
And so we did an ultrasound to the Doppler, and we saw that there was no flow beyond a certain
Right.
point.
Okay, perfect.
I just want to make a point that in someone who really truly has acute limb ischemia, oftentimes they don't have time for lysis. You know, lysis is, you have to do something to improve the flow, but, lysis is going to take at least 24 hours probably. So if they are truly acute, then you have to consider whether they are the appropriate patient for lysis as opposed to something else that will more promptly restore flow. The nice thing about lysis is that it will recruit your collaterals, and it might help open up the tiny little, it'll fix the outflow in the foot, which is really important. But, this patient sounded like he was on the verge of a non-salvageable foot.
Yeah, and ECOS has helped in this a little bit. Instead of we bring the patient back to the catheter in 4 hours really to look at things, how they do. But I agree with you. You usually, to get rid of the pain, you usually need to get some flow, whether with balloon angioplasty or something, and then put the ECOS, absolutely. But I think conventional TPA with a lysis without ECOS that takes 12 and 24 hours, yeah, patients can lose their legs because of this.
Yes.
Perfect. Well, any other questions from the audience? Right, perfect. Thank you.
Thank you.